our last video, we talked about what pregnancy is all about, all through the pregnancy days, the first trimester, second trimester, and third trimester, and things you are to expect. By now, you should have an idea of what pregnancy is all about, and also have an idea if you really want to have a baby. And if at this point you want to have a baby, or you are actually curious on what steps getting to pregnancy and childbirth is all about, then this video is for you, because in this video we will be diving into the pre-pregnancy planning, what you are supposed to plan for. See, pregnancy journey is very, let me not use a word that will scare you, but it's very broad and it requires your full attention, your full involvement in it. It's not what you have to do haphazardly. So that is the reason you have to plan, you have to prepare yourself for this journey if truly this is what you want to do, because it's a lot. So if this is exactly what you want to do, then this video is for you, because here we'll be looking at the plans you have to make. Now let's dive right into this video. After you have gone to subscribe, please subscribe. Your babe needs subscription. Yes, please go and subscribe, and then refer this video. The pregnancy plan is all about the steps you are going to take, the measures you're going to take to help you achieve the better results of pregnancy. So these are the various steps that you need to take before you even conceive a baby. So you have to prepare yourself. Like I said earlier, pregnancy journey is a whole lot, and you have to get really ready. In preparation, you have to prepare medically, you have to prepare psychologically, you have to prepare mentally, well, psychological, mentally, emotionally, you have to prepare, financially, you have to prepare, and social wise as well, because when you get pregnant and give birth, you don't owe yourself anymore. Before you think about anything, before you think about your social life, you have to first of all consider a newborn baby. So you have to prepare emotionally, you have to prepare psychologically, you have to prepare financially, you have to prepare medically, and if you're religious, you have to also prepare spiritually. So let's take a look at the preparations you have to do medically. Now, the first thing I think you have to do when you want to get pregnant is make sure you are fit medically. So visit the hospital and speak to a gynecologist, a midwife, run series of tests to determine that you are actually fit to have babies. There are certain conditions that will prohibit you from having a baby, something like leukemia and some other these health conditions and challenges can prohibit you from having a baby. So you have to go to the hospital and get yourself checked all over to see that you are actually fit and ready to have a baby. And not just that, if you have a health condition that requires serious attention while you are pregnant, you may wish to know this and get all the medical team on board with that, so that they know how best to assist and support you through your pregnancy journey. If you already have a medical condition and you are taking a certain medication, this has to be put into consideration as well. You have to discuss with the medical team to see if this medication needs to be put on hold while you are pregnant, or you have to, take it, because some medications can cause harm to your baby. So this is what you have to look out for. If you're already taking a medication for a certain health condition, you may have to speak to your medical doctor or whoever prescribed these medications for you, and see how best the medical team can support you with your health condition and your pregnancy journey. The next thing is you have to find out what will make your reproductive system very accommodating for your baby. What I mean here is are there things you're supposed to do to get yourself really ready for this baby medically? Let's say taking pregnancy vitamins, something like folic acid. Taking folic acid has been shown to help pregnant women and their babies maintain a healthy life, a healthy baby all through pregnancy period. It helps to reduce the risk of congenital conditions happening to your baby. So you may want to take pregnancy pre-pregnancy vitamins. And another thing is look out for if there are vaccinations that you're supposed to take to prevent certain medical conditions from developing while you are pregnant. If you want to give pre-pregnancy vitamins a chance, I would suggest you speak to the medical team as well as to when is best for you to start. Usually, I will recommend that you have this folic acid taken at least 1 month before you conceive. Like I said earlier, it helps prevent certain birth defects in your baby growing in utero. Another thing you should look out for is being on a healthy weight. You have to understand your body mass index and know what weight is supposed to be healthy for you. And this you can do by knowing your height and your weight and calculating it to know what your body mass index is. If you're obese, if you're underweight, if you're overweight, this you have to understand. And again, run series of investigations to understand. There are some women who, especially athletes, who's got iron deficiency in their body. If this is the case, then you may need to get it boosted before you think about getting pregnant. So if you had the condition previously, if you had a surgical procedure like you had a weight loss surgery, you may need to speak to your doctor to see when it is best for you to have get pregnant, because you may be losing some of the important nutrients needed by your baby. If you're not on a healthy weight, I would recommend that you start getting yourself to a healthy weight before you think about conceiving your baby, because being overweight can predispose to certain pregnancy-induced conditions like diabetes and hypertension. So you have to try and be on a healthy weight. Again, your lifestyle choices and your feeding, your nutrition, you have to eat a healthy, well-balanced diet. You have to get rid of, if you're a smoker, this is the time you have to stop smoking. If you like alcohol, this is the time you have to get rid of alcohol. And if you're someone that has a tendency for substance abuse, I think this is the time you have to get clean before you think about getting pregnant, because these things have been established. It has been proved through research that they can cause harm to your baby in your womb. Still speaking on maintaining a healthy lifestyle, I will think you should as well exercise regularly, and then sleep. Get enough sleep. Aim at getting about 7 hours to 9 hours sleep a day. You shouldn't be sleeping less. You should get enough rest. This has to get your body relaxed for the baby. And then eat well-nourished diet. This is not the time for you to be eating junk, having series of caffeine and things like that. You have to have a healthy diet. We will have to make a separate video to talk about healthy diet and nutrition before pregnancy and while pregnant and even after pregnancy. So you maintain a healthy lifestyle by monitoring your weight and being on a normal weight, exercising regularly, having a good rest, getting enough sleep. Another thing is rehydrate well, drink enough water. I can't overemphasize on that. You have to get enough fluids down you. You have to get enough fluid in you, please. It is very, very important. Now, after your healthy lifestyle, the next thing you have to do is, I think, you have to prepare financially. Now, you've prepared medically, you're ready medically, you've done series of tests to see what's wrong and good and going well with you. You've spoken to your medical team and they've given you a go ahead that you are fit for getting pregnant. The next thing is, you have to get ready. You have to prepare financially. If this baby is coming, you have to get ready. You have to be financially ready. So you have to look at what is going to cost within the place you are living to deliver a baby. If you're doing a vaginal delivery, how much is it going to cost? If you're going through cesarean section, how much is it going to cost? And this is why it is so important to prepare medically, because through your preparation medically, you'll be able to find out if you're going to push out your baby through your vagina or you have to go through a cesarean section. So it will help you to plan financially. Now, when you find out how much is going to cost to prepare, how much is going to cost these birthing methods, how much they are going to cost, and then the materials needed during pregnancy and after childbirth, how much are they going to cost? Where are we going to live? Where am I going to live with my baby when I give birth? How much is it going to cost? You have to plan yourself at least 1 year after giving birth, and then plan 6 months into the pregnancy. So it's 1 year, 6 months. How much is it going to take every single month to cater for this pregnancy and birth? How much am I going to spend monthly? So when you know how much that's going to cost you, let's say it's going to cost you £500 every single month to look after yourself while you're pregnant and when you have given birth, then you have to multiply it by a year, 6 months. And how much it gives you should give you roughly £9,000. So this is how much you're supposed to have in your bank account. And if you don't have this, you should be working towards having such amounts to get you ready for when the baby is coming. Psychologically, you need to be ready. You need to be ready emotionally and mentally. And to do this, I recommend that you speak to a pre-birth counselor through pre-birth counseling. I know this is not usual, is not what we usually know, and is not quite common, but it exists. So this is basically speaking to a therapist who is either a midwife or someone who is medically inclined in the gynecology and obstetrics section. And they will walk you through the details of what pregnancy entails, every single thing you need to know, and how best to prepare for this. So they walk you through preconception, they walk you through conception, they walk you through all the trimesters, what you are to expect, and what your actions should be to help you manage the stress that comes with this. So it is quite important. The people who have gone through pre-birth counseling has actually recommended this for women to go through. So it's basically going to a therapist who is medically inclined to talk about pregnancy. So I would really, really recommend that you see a pre-birth counselor before you even think about conceiving your baby. So when you speak to a pre-birth counselor, they will be able to, you'll be able to ascertain if this is actually what you want to venture into. So there's no sugarcoating of anything. They will be empathizing with you, but at the same time telling you the truth of what is involved with pregnancy and pregnancy journey. So it helps you make an informed decision of if this is what you want to go into. Because I've seen people giving to societal pressure of getting pregnant, peer pressure sometimes of getting pregnant. So if you speak to a pre-birth counselor, these things can be managed, or it can help you have a clear vision of what you actually wanted to do, or what you actually want out of the pregnancy journey. So it is really, really very important that you see a pre-birth counselor. Most of the things I'm mentioning here, they also mention in the pre-birth counseling section. So they talk about your financial readiness, they talk about your emotional readiness, they talk about every single thing that you need to get ready for pregnancy journey. Now, after you've spoken to a pre-birth counselor and you think this is what you want to do, the next thing is, I think it's time for you to start knowing your menstrual cycle. So you need to know your menstrual cycle and track your menstrual cycle. That will help you, one, to actually know the date or the months you're going to give birth to. Personally, there are certain months that are so dear to me that I want to deliver my baby. You see April, you see September, you see some of the months, February is part of them. I want to deliver my baby in this month. So knowing your cycle will help you to track the months you want to give birth to your baby. And some women want to give birth to their baby on the birthday of their husbands or their own birth month, or they just decide which month is the one, and that will help you to plan. So when you work your way around 38 to 40 weeks gestation, which month will it fall into? That will help you to know which month you want to get pregnant. That's one. It may sound silly, but it's actually important to some women. I mean, women are emotional. What do you expect? We actually try these things, it's sentimental to us. So we do them. We do it. So if you're like me that, have things you cherish so well that has sentimental values for you, by all means, so you track your menstrual cycle to help you. Another thing is, if you want to have a certain sex of a baby, then it will also help you to track at what point will you get pregnant to have a baby boy or a baby girl. Don't worry about it. We'll discuss it in a separate video in details. Now you track your menstrual cycle. That's another one. Now that you know your menstrual cycle very, very well, the next step you have to take is, well, there's no pregnancy without getting your partner on board. I don't know if you want to have a baby without having a partner that's going to, get on board with it. I know some people go through single motherhood or whatever, but if you want to give your baby the best life possible, you have to give them the gift of having both parents involved in their life. So you have to get your partner on board. Of course, you can't get to this point of trying to have a baby if you don't have a partner who is in line, who has the same vision and view as you, a partner that wants kids. So you can't possibly have kids. It's not a personal decision. You have to deliberate this with your partner so that it doesn't appear selfish. So now that you know you want to have a baby, get your partner on board. Have a discussion with them. All this planning, you have to incorporate your partner into the planning. Now, in the next video, I'm going to make a separate video for partners. I'm going to make a separate video for partners of people that are getting into pregnancy journey. So you are going through this journey with your partner, with your wife. I think I need to make a separate video for you because it's a whole lot as well. The preparation that you have to make to get to where you're going. You've prepared your mind. You've prepared yourself mentally. You've prepared yourself medically. You've gotten ready financially. Your partner is on board with you. I think you have to build a support system. Yes, you have to build a support system because no man is an island. And in this pregnancy journey, believe you me, you will need people. Get your partner on board. Get your family and friends on board. Get all the people that are so dear to you that can support you emotionally. Get them all on board. One person can't give birth to a baby. It takes a community to raise a kid. So get your community of supporters. Get your support system. Build your support system. If you have people that love you so much, or people you cherish so much that want to be in your life, people you want to be godparents to your baby, get them all on board in this pregnancy journey. I appreciate it if you want to keep your pregnancy journey private. It's also good, but I will recommend that you get a support system so that when it gets really tough, you have people to back you up. Having said that, after building your support system, I don't know where this is supposed to come in. I'm bringing it last because I know that it's not everybody that is religious. But if you're actually religious, you need spiritual preparation. You need to be ready spiritually. Go to God in prayer and speak to Him about conception. Have a prayer moment with God. Speak to Him about your pregnancy plans, your pregnancy journey, and ask Him to work with you all through the journey and be with you on the day of your delivery. It's really, really important. Depending on what religion you believe in, even if you don't believe in anything, go through meditation. It helps you. It helps you, especially during delivery moment. It's called hypnobirthing. So just get into meditation, get into prayers, get into involvement of God in your pregnancy journey, and you will really, really enjoy it. I'm rooting for you, and I wish you all the best in your pregnancy journey. Stay with my love, and I will see you in the next video.